Hello there, I'm Dr. Phil. Today we're going to be talking about scrotal lumps. You'll be pleased today that I won't be examining my own scrotum. I think the sight of a 47-year-old GP's scrotum is probably too much for your cornflakes. So I'm going to use these little accessories, my plums. Oh look, I've got a bit of a bruise on my plum already. Now the thing about your plums is they come in a handy carrying sac called the scrotum. And in a healthy man, your scrotum should look about 30 years older than you are. If you look roughly the same age as your scrotum, get some sleep. It's a handy little test, little top tip there. Now the scrotal lumps that really matter are the ones that are actually within the plums themselves. If you examine your scrotum, probably best to do it after a hot shower. Things are nice and relaxed, sagging down a bit. Put them in the palm of your hand. You'll find that your plums should roughly weigh the same. In a lot of people, one plum is slightly bigger than the other one, but they should roughly weigh the same. In most men, the left plum hangs down slightly lower than the right one. You sort of weigh them in the palm of your hand, and then one at a time, just gently between thumb and fingers, just gently rotate them round. Obviously not all the way around because they'll come off. Most men aren't very good at multi-skilling, so I say generally do one plum at a time. And what you're looking for is a lump within the plum itself, so not in the scrotum around the testicle, but actually within the body of the testicle. And it'll start often like a little grain of sand. And you'll think, oh, a little bit tender, that's not quite right, like a grain of sand. Then it gets the size of a pea, and you think, oh, that's not quite right. You should have gone to the doctor by then. What generally happens with blokes is they go, oh, I've got a lump in my testicle, it's embarrassing, it's in my testicle, it's a lump, that's embarrassing, and they let it get bigger. And then it gets so big they think the doctor's going to think I'm a complete arse for having left it so long. I once saw a bloke whose testicle got to the size of a grapefruit because he was so embarrassed about having a lump. So the lump will start as a grain of sand. If you get it at that early stage, easy job sorting it out. 96% of testicular cancer is cured these days. The bigger it gets, the more likely it is that they may have to really remove a bit of your testicle. Sometimes the whole testicle, but even then the chance of cure is pretty good. So certainly, grain of sand, great. If it's the size of a pea, definitely you should be down that doctor. Outside the testicle, you have like some tubes, some sperm collecting tubes called the epididymis that feel a bit like al dente spaghetti. Sometimes you can get like a bag of worms, you can get varicose veins around then, and sometimes you get a little cyst there. If it's very tender around the testicle, you can get epididymitis, and that can sometimes happen with a sexually transmitted infection. And then above, behind the epididymis and up, you've got the sperm collecting tube that takes the sperm out. When you get to my age, 47, testicular cancer gets rarer. You generally get hernias in your testicle and your guts can come down into your scrotum. There's a famous picture in a surgical textbook of a bloke whose entire gut came down through a hole, like a hole in a sock, in his inguinal canal, and he had his entire guts in his testicle. He had to push his scrotum around in a wheelbarrow. That's a great photo, probably on the internet. But the bottom line is, look after your plums, examine them once a month or so after a warm shower. Any lump, any little grain of sand, anything within the testicle itself, get it sorted. For more amusing top tips on your sexual health, I would recommend Sex, Sleep or Scrabble, available at all major outlets, and of course a visit to the embarrassingproblems.com website, which has a whole wealth of information about embarrassing problems. See you soon.